Member for Essex.
Thank you, Madam Speaker. I'm so proud to rise today in support of this NDP motion that calls on the government to have a meeting to start the conversation about implementing a Universal Pharmacare program. This is something that New Democrats have been fighting for since Tommy Douglas introduced and implemented public Medicare in our country. New Democrats refer to the amazing vision that Tommy Douglas had, and his vision of a social system that is accessible to us all still guides us today. It is a fundamental belief that we are all in this world together, and that the only test of our character that matters is how we look after the least fortunate among us, how we look after each other, not how we look after ourselves. And that no matter what, people should get whatever health services they require, irrespective of their individual ability to pay. Tommy Douglas never intended to create such a gap in Canadian healthcare coverage. Prescription drugs and other services were always meant to be integrated into a system of comprehensive public coverage, along with hospitals and physician services. Canada is the only developed country in the world with a universal healthcare program that doesn't include a universal prescription drug plan. This means that our multi-payer system has resulted in the second highest prescription drug costs in the world, second only to the United States. Our patchwork prescription drug system is inefficient and expensive. It has left Canadians with wildly varying prescription drug coverage and access, and many people are paying different rates for the same medications. Currently, people are not benefiting from our system. But do you know who is, Madam Speaker? The pharmaceutical and private insurance companies. Those same pharmaceutical and private insurance companies that make billions of dollars in profit every year. Did you know, Madam Speaker, that in 2016, Merck Canada made a $35.2 billion profit, and Bristol-Myers Squibb earned $19.2 billion? What about the fact that in 2016, Purdue Pharma reaped profits of $31 billion? Purdue sells OxyContin and other products prescribed for the treatment of pain, and Purdue has been found to have misled doctors about the safety and effectiveness of OxyContin. As we all know too well, Canada is facing a public health crisis where at least 2,400 Canadians have died as a result of opioid overdose in 2016. And what about the top private insurance companies? Did you know that the top 3 companies in Canada collectively raked in net profits of over $8 billion in 2016? Pharmaceutical companies can charge higher prices for drugs because they sell to so many buyers. Private insurance companies benefit by charging employers, unions, and employees to administer these private drug insurance plans. Why is it acceptable that in Canada, a corporation can have profits of $35 billion, but a senior living in my riding can't afford to heat their home and buy their medication at the same time?
Shame.
Seniors represent one of the fastest growing populations in Canada today. The number of seniors in Canada is projected to reach 9.8 million in 2036. Many more seniors will be retiring in the years to come. Therefore, we need to have a social safety net in place to avoid dramatic increases in the rate of poverty. A universal pharmacare program would significantly help our seniors and would cost our healthcare system less. And I want to specifically speak to you here today about what I see in my constituency office. I have people who come in my office who are desperate for help. Many seniors, but certainly people of all ages, tell my staff that they cannot afford their medications. Couples will often split one prescription between them, or they will skip taking their medicine so they can afford a new pair of glasses that allow them to see properly. One woman came in last week, and she's on ODSP, that's the Ontario Disability Support Program, and she cannot work because she has very serious mental health issues. She needs her medication to function, but not all of her medication are covered by ODSP, and sometimes they're only partially covered. Often she must decide whether to pay her utility bills, to buy groceries, or to pay for her medicine. She came into my office because she chose to pay for her medication 1 month, but then she couldn't afford to cover her utility bill, and her phone was cut off. This woman relies upon the services of our local mental health crisis phone line, and the counselors provide her with the support she needs to manage that illness. And her phone was cut off. She was devastated. and she told my staff that she regularly uses the money she has for food to cover her utilities or medication costs. This isn't right, Madam Speaker. This simply isn't right, and we see it in all of our constituency offices every day. Earlier this week, we debated tax fairness in this House, and I spoke about the true unfairness of income inequality. And I'm going to repeat some of the shocking, heartbreaking statistics that are a reality in Canada today. According to the census data, the richest 1% now makes 6.8 times more than a worker making Canada's median wage of $34,204 in 2015. In the Windsor-Essex area, the United Way says about 1/4 of our youth live in poverty, which means that in 2013, 19,900 children under the age of 17 lived in families where their income was less than $17,000 per year. This is not only unacceptable, it's offensive. When you earn this little per year, there is no room for paying for medication, and people are making very difficult decisions about their health. It's time to move forward with a universal prescription drug plan that will save money through bulk purchasing power. In New Zealand, where a public authority negotiates on behalf of the entire country, a year's supply of the cholesterol-busting drug Lipitor costs just over $15 a year. That's compared to $811 per year here in Canada. This is a life-saving drug, and hundreds of thousands of Canadians take it. That's why Canada needs to combine the purchasing power of all Canadians under one plan. An annual investment of $1 billion by the federal government will mean that Canadians save $7.3 billion a year on the medications that they need. What New Democrats believe, and what I wish to emphasize today, is the fundamental belief that people should not have to worry about whether they can pay their hydro bill or afford their medication. I have some stats from the Canadian Labour Congress today, Madam Speaker, but before I do that, I want to read a quote from their president in a release that was issued today. This is from CLC President Hassan Youssef. We are pleased that the NDP, under its new leader Jagmeet Singh, is continuing to make pharmacare such a priority, and we hope all political parties respond by making this much-needed program a reality as soon as possible. Madam Speaker, if the Liberals claim to be standing up for Labour in this country, if they claim to be standing up for working people, then I hope that they will heed the advice of the Canadian Labour Congress President today and support what New Democrats have brought forward. But I want to read you some of the stats that they have. About 8.4 million working Canadians don't have a prescription drug coverage. The less you earn at work, the less likely you are to have prescription drug coverage. Women and young workers are less likely to have the coverage that they need. Even those with drug plans are paying ever-increasing co-payments and deductibles. New Democrats are not alone in our belief for national pharmacare. An overwhelming majority, 91% of Canadians, believe that our public health care system should include a universal prescription drug plan. And it's not just New Democrats that are calling for this desperately needed action. Several national health care commissions have also recommended the same, along with the Canadian Medical Association, Canadian Federation of Nurses Unions, Canadian Doctors for Medicare, Federation of Canadian Municipalities, the Canadian Health Coalition, Council of Canadians, CUPE, Unifor, and the Canadian Labour Congress. If this government is a true friend to all of these organizations and Labour, it's time for them to stand up. Madam Speaker, we are calling for a meeting. Surely the Liberals can commit to one meeting to talk about where we're going in this country for pharmacare. All we're asking in this motion is that in 1 year we have that meeting. It's time for action. Canadians have waited long enough. It's time to start the conversation. Bravo.